everyone, so let's move towards our today's topic, which is
tubular reabsorption. We have discussed in the earlier lectures that glomerular filtration hoti hai, and we have discussed, I've told you that urine formation consists of 3 steps. Number 1 is filtration, which occurs in glomerular capillaries and between glomerular capillaries and Bowman's capsule. Then from Bowman's capsule it enters into the renal tubules, that is proximal tubule, collecting tubule, distal tubule, loop of Henle, and etc. And these tubules basically help in reabsorption of the useful substances which are filtered out from the glomerular capillaries. Then after that thing, the secretion process will occur. Now in this lecture we will talk about the reabsorption in detail, reabsorption step in detail. So that reabsorption obviously takes place in the tubules, renal tubules. That's why it is also known as tubular reabsorption. It is the second step in urine formation, and it takes place like in proximal tubule. Obviously Bowman's capsule is continuous with proximal tubule, then loop of Henle, then distal tubule, and the collecting tubule. One more thing which you have to remember, that the thing is tubular reabsorption, obviously as the name indicates, the reabsorption will take place in the tubules, but on the same time there are some substances which are secreting from the tubules, like potassium, like in some cases bicarbonate, in some cases hydrogen will also secrete it, and we will discuss in future. But the point is, you have to remember that not only just reabsorption is taking place, at the same point with the reabsorption, along with the reabsorption, secretion is also taking place in the tubules. Now the tubular reabsorption is very selective. Okay, if I talk about the glomerular filtration, it's like glomerular filtrate, प्लाज्मा प्रोटीन के अलावा सब कुछ फिल्टर हो रहा था वहाँ पर. But in tubular reabsorption there is a checking mechanism, there is a mechanism which you can say that this is a checking mechanism through which the useful substances which are helpful for our body, that will be that will be reabsorbed in our body, and then after that the non-useful substances which are not useful for our body, or in other words that are waste product, that will remain in the tubules and that will release out of the body. They will excrete out of the body in the form of urine. Now in the tubular for reabsorption, what happened, before starting the topic, you have to remember that there are epithelial cells which needs to be crossed. Okay, if I talk about that, if we start from lumen, so basically the inner boundary of the lumen consists of epithelial cells, and those epithelial cells consist of 2 membranes. Okay, the luminal membrane, which is on the lumen side, and on the opposite side basolateral membrane is present. Okay, obviously on these membrane, the luminal membrane and basolateral membrane, sodium potassium pump is present, where active transport occurs. Many other transporters are present: sodium hydrogen co-transporter, sodium chloride co-transporter, and many other co-transporters are present, which we will discuss in further topic. So it's my humble request to all those who are watching this lecture, that before to understand this lecture, after watching this lecture, please do give a review, do read Easy Medical Book Volume 2. That will help a lot, because after watching this lecture you will understand what is happening, and when after understanding this lecture, when you will read the Easy Medical Book Volume 2, that will be more easy for you to understand that thing. Now step by step we will discuss कि proximal tubule में reabsorption हो रही है, कैसे हो रही है, क्या हो रही है, loop of Henle में हो रही है, distal tubule में हो रही है, and then फिर हम जाएंगे further आगे cortical collecting tubule and medullary collecting tubule की तरफ जाएंगे. But before that, like I said, active transport होती है. Penocytosis. What is penocytosis? It is a type of endocytosis in which the fluid particle will be intake into the cell, that is called as pinocytosis. And if I talk about the active transport, there are two types of active transport. One is primary active transport, through which it will act that will occur due to the difference in concentration gradient. And if I talk about the secondary, that and one more thing, the primary active transporters in kidney are sodium potassium pump, hydrogen ATPase, or hydrogen pump, hydrogen potassium ATPase, or hydrogen potassium pump. And these are the things. But if I talk about the secondary co-transporter, secondary एक्टिव ट्रांसपोर्ट, दैट इज़ लाइक के सोडियम के साथ, जैसे अगर सोडियम की ट्रांसपोर्टेशन हो रही है, रीएब्जॉर्प्शन हो रही है, तो सोडियम के साथ ग्लूकोज, अमाइनो एसिड या कुछ और बैठकर सोडियम के साथ जो है ना आपके साथ लग कर अलॉन्ग विद द सोडियम दे विल रीएब्जॉर्ब, दैट इज़ कॉल्ड एज सेकेंडरी एक्टिव ट्रांसपोर्ट. ओके, so obviously those are sodium glucose co-transporters are present. Obviously, as the name indicate, the glucose will be reabsorb, will transport along with the sodium. That's why they are called as sodium glucose co-transporters. And the short form is SGLT. Okay, so there are two types of sodium glucose co-transporter, SGL2 and SGLT1. Okay, SGLT2 and SGLT1, these two are the types of sodium glucose transporter. Same like that, there is another transporter, that is glucose transporter, GLUT2 and GLUT1, that is GLUT1 and GLUT1 and GLUT2. These are the two types of glucose transport which help in the which is present on the basolateral membrane, and they will transport the glucose, and they will reabsorb the glucose inside our body. Because सेल जो है एपिथेलियल सेल्स, उसकी वन साइड पे तो एक साइड पे तो लुमिनल मेम्ब्रेन है, वहाँ पे अगर सोडियम ग्लूकोज को ट्रांसपोर्टर है तो क्या होगा कि सोडियम सेल के अंदर आएगा और ग्लूकोज भी आएगा, लेकिन एट द सेम पॉइंट ग्लूकोज को वापस हमारी बॉडी में आना है, क्योंकि हमारी बॉडी में उसका काम है, अगर काम है तो. अगर तो एक्सेस हो जाता है, फॉर एग्जांपल काफ़ी अगर आपने मीठा खा लिया है तो ऑब्वियसली देयर इज़ अ लिमिट. ओके, so that limit will be crossed, and that is a different thing we will discuss in future. but the thing is कि अगर आपने ज़्यादा मीठा खा लिया तो फिर ऑब्वियसली ग्लूकोज एक्सीडेट आउट हो जाएगा. पहले तो ग्लूकोज स्टोर्ड होगा ग्लाइकोजन की फॉर्म में, फिर और स्टोर होगा, फिर वो रिलीज़ आउट होगा अगर बहुत ज़्यादा हमारी बॉडी में स्टोर हो गया होगा. सो दिस वॉज द बेसिकली overview, but in the next part of the tubular reabsorption we will start step by step कि proximal tubule में क्या हो रहा है, loop of Henle में क्या हो रहा है, and some other things as well. Till then what you have to do is work hard, study hard, and good luck, and remember me in your prayers. Take care. Thank you.